screening for prostate cancer should begin at 40 years old for men with a high risk and 50 for those with average risk. I spoke with a urologist from Houston Metro Urology about prostate cancer.
If the man has a father, a son, an uncle, a brother that has had prostate cancer, that makes them high risk. Also, if they are of African American descent, or also if there is any germline mutation like BRCA, then they are considered high risk for prostate cancer, and I would encourage them to come in and get evaluated and screened for prostate cancer starting at the age of 40 years old.
But is it true that if the PSA increases dramatically from one test to the next test, that could also indicate that something's wrong, even if the number isn't that magical number indicating cancer?
Absolutely, yes. So the PSA could be low, but as urologists, we tend to trend the PSA and make sure that it kind of stays in line. But if, like you said, if there's a quick rise in the PSA, then it would definitely make us suspicious and want to, evaluate prostate cancer.
Yeah, so don't get too hung up on the number.
Yes.
We're looking at the trend.
Absolutely.
And according to the American Cancer Society, when it comes to testicular cancer, the average age of males is about 33. This is largely a disease of young and middle-aged men. Symptoms for testicular cancer include a lump or swelling in either testicle, a feeling of heaviness, a dull ache in the lower belly or groin, and enlargement or tenderness of the breast tissue, as well as back pain. And here's something else that you might not know. Men can take a pregnancy test to look for testicular cancer. A positive test in men can indicate signs of testicular cancer because the hormone HCG, which is detected in pregnancy tests, would be elevated if you have that kind of cancer. However, doctors say that really is not a reliable method because it can give false positives and false negatives. So ultimately, it is best to go to the doctor and determine your risk.